With the CDC in turmoil, California, Oregon, and Washington are banding together to issue their own public health guidance.
We're profoundly fractured. Right now, the CDC is putting out guidance that the CDC employees don't actually believe in.
Dr. Monica Gandhi with UCSF says this health alliance is significant.
This has to do likely with insurance coverage and who's going to cover vaccines.
Insurance coverage for vaccines is based off of CDC recommendations. And she says with Health Secretary Robert F. Kennedy Jr.'s vaccine skepticism, California's new alliance may offset damage.
There may be recommendations coming out of the CDC that will say that people can't get vaccines. That means insurance will not pay for a booster if you're, say, 25 years old. And a 25-year-old may want that booster, but insurance will not pay for it if the CDC has said no. So by California, Washington, and Oregon saying anyone can get this vaccine, the COVID vaccine, then insurance will say, okay, I see these recommendations, I'll pay for it.
The U.S. Department of Health and Human Services slammed the alliance and those states' pandemic-era policies, saying, quote, HHS will ensure policy is based on rigorous evidence and gold standard science, not the failed politics of the pandemic.
You could not have found a worse person to be in charge of Health and Human Services during this measles outbreak than him.
Dr. Paul Offit was recently booted from an FDA vaccine advisory panel. He says cuts to the CDC exacerbated the recent measles outbreak in Texas.
People who work for the Texas Department of Health asked the CDC to please come help them. And the CDC didn't really respond because they'd been shredded by Robert F. Kennedy Jr.,
warning Americans to expect the spread of several diseases, especially as states like Florida move to eliminate all childhood vaccine mandates.
The resurgence of vaccine-preventable illnesses will lead to childhood mortality and morbidity, and it's absolutely unnecessary.